Hey YouTube, how's it going? Selena here, and this is going to be my 37 and 38 weeks update. Um, Today is September 23rd. I'm currently 39 weeks and 2 days, so let's hope he comes soon. So the first thing I'm going to talk about is bras. Um, I do not have one nursing bra. I tried it on. My mom just got it from Walmart. It's a size large. I wish I had it to show you guys, but it's in my hospital bag. So whenever I do the hospital bag video, that's when you guys will see it. But it's kind of shaped like a sports bra, but it's not. It's a nursing bra. So, but one thing that I don't like about it is that the straps in the back part for me are really tight and it's uncomfortable. So that's not something that I will probably be comfortable with wearing all day long, and I think that bra was like $13, but you guys will see that in my next video. But what I do have though are these, and these are not nursing bras, they're just regular bras. I bought them off of Amazon. I was watching this one video with this lady, and she was saying that she didn't wear nursing bras. She just brought the bras with the removable straps, and she got those off of Amazon for really cheap. So that's what I did for mine, and I actually have one on now. These are actually really comfortable. I think the ones that she bought were $3 for some kind of price, probably $20 or something like that. Mine were $4 for $20. I guess the only bad thing about these is that they are one size, but I will show you guys what they look like. I think that these would be perfect for nursing in. They're cheap, they're comfortable, and you can wear them all day. With me, my regular bras are really uncomfortable, and I don't even really know what size bra I am right now. I have 36D, which the cup is too small but the band fits nicely, and then I have 36D where the cup is fine but the band is too tight for me. So that will kind of give you guys a kind of idea of how big I am. So I'll show you guys these, and these, like I said, are one size. They are seamless, removable straps, slightly padded bras. They come in a 4-pack, which is dark brown, nude, ivory, and black. They're not the most flattering bras. So here is one of the bras. And then it comes with the clear straps. And you can put those, you can switch those out, or if you lose the regular straps, you can put those on them. And the pads and the bras do come out, so that's a good thing. The brand is Anemone, I guess. I don't know, something like that. But I will put a link to these down in the description box if you want to check them out. I think they're good for nursing because the straps are movable. You can just, you know, pull it down to nurse and all of that good stuff. And here's actually, I took the pads, I have on the white one, and I took the ivory one, and I took the pads out, and this is what they look like. And this is how thick they are, so you can see that they're really thin. I think I prefer to wear it without the pads in them. So the next thing would be something that I actually made for him, which are these high contrast cards, because newborns, they love to look at the different black and white images. So I made some of these for him. They do have apps, but the vast majority of them have to be paid for. They have videos on YouTube. I haven't actually looked any of those up, but I figured it would be nice to have something for him to physically hold for when he does get older. So and then there's also templates or whatever, and you can print those out and use those and maybe just laminate them or whatever. But these, I don't know if you can tell, but I actually did myself using marker, and then I laminated them. So, and this is supposed to be a cat. This does not look like a cat, but it's supposed to be a cat. And then here's on the other side, and then here's a heart, and then a snail. So I'm hoping he'll like these. My mom said he will, so it's something for him to look at that I can hold up to him, that I can just place somewhere in front of him, especially during tummy time or something like that. So this is an idea for newborns. They love to look at things that are black and white. So last week at my last doctor's appointment, I realized that I do not like my doctor that I have here in Washington, which is a shame, because when I was in Georgia, I liked that doctor. When I was in Ohio, I also liked that doctor. But now that I'm here in Washington, I don't like this doctor so much. I was hoping that maybe, you know, I would start that my experiences, you know, would get better and better, because the first day I went, it was during lunchtime, so of course she was a little rushed because I'm pretty sure she wanted to go eat lunch. And then the next appointment, it was like, okay, whatever. But then my last appointment, I didn't even see her. I ended up seeing another doctor because she had an emergency, which is fine or whatever. You know, doctors are humans too. They have emergencies. But the thing is that the person that I did see, the doctor's assistant, I think it's a doctor's assistant, nurse assistant, something like that, she told me a lot more than what my doctor did. So she told me that I was in between 1 and 2 centimeters dilated, which the week before I was only 1 centimeter dilated. So that's good. And I do have an appointment today, so let's hope that I've dilated more. But then she also told me how much I'm effaced, which is 40% effaced, and my doctor didn't tell me that. And then she also told me what station he was at, which is -2. And she told me that I believe at my next appointment, if he hasn't came by then, that is when we'll start discussing being induced and things like that. I don't think that they induce until 41 weeks or sometime after due date or whatever. But you know, it's just, I didn't have to ask. She just told me all this stuff. And the reason why I never asked with my doctor before is because I didn't know if she was already recording this information or telling me anything. And, or, you know, if she just told me just what she knew at the time. I didn't know that if they already did effacements and all that stuff. But the other doctor, she just told me it all. She even discussed some stuff from the last appointment. So I actually really like that better. I don't feel like I should have to ask certain things. I don't feel like I should have to ask to know how much effaced I am, what station he's at. It's just, you know, something that you should tell. And then it just, I don't know, she just seemed so much better. So I don't know if, like, maybe my doctor is the way she is because she has appointments back to back to back, because they really do, and she's just trying to get from one patient to the next, or if it's just that's how she is. I really don't know, but I really don't like her. So one of my concerns right now is whether he is in the anterior posterior position. Posterior is when his back is facing my back, and anterior is when his back is facing out, so like facing my belly button. And the best position for the baby to be in is anterior. And so reading the articles and whatnot, I realized that he was in the posterior position. I don't know if he still is, but today at my appointment I will ask, and then I plan on, hopefully, if he is doing stuff to start helping him turn, because a baby that's in the posterior position has a harder time coming out. I will put 2 links down in the description below that talk about the different positions and the way to tell what position that they're in, and I'll put that, I'll link those 2 down below. So I've started going for walks every day now. I want to say I walk about half a mile. I'm not exactly sure. Somewhere around there. The first we've only been on 2 walks. So the first walk was kind of hard. I kept having Braxton Hicks contractions during the walk, and that made walking harder. But then the second walk was actually a lot easier. So I think the more I walk, the easier it get. But hopefully it'll also help me dilate and stuff like that. So speaking of Braxton Hicks, I've actually been having a lot more of those. So if I'm standing up for too long and walking for too long, I do end up having more Braxton Hicks contractions. When I'm sitting down, I have them more often. And for me, Braxton Hicks contractions, I don't know if I said this in my last video, it's just sometimes I can feel it, sometimes I can't feel the tightening in my stomach, but you can actually see his body shape more in my stomach. But I always, like, I can feel my heart beating more, and it feels weird to breathe. I guess it's a little harder to breathe. And that's how I know where I'm having Braxton Hicks contractions. So yeah, but I don't always feel it in my stomach. Sometimes I do, sometimes I don't. And sometimes they hurt. Whenever they do hurt is when he's on my fibroid. So it's not like the contraction itself that hurts, it's just him on top of my fibroid. And he's actually switched sides. He's been on my left side pretty much my whole pregnancy, and now he's on my right side. So that's something that I'm worried about because my fibroid is also on my right side. But so far it really hasn't been too many problems with that. Sleep is getting harder to sleep at night. I don't go to sleep until 1 o'clock in the morning. Like, I'm tired way before then, but when I get in the bed, I can't sleep. So I don't go to sleep until 1, even though I'm tired. This thing right here, she's behind me making noises and whatnot. But so sleeping is harder. I do think that I am at that point where I'm starting to get more miserable and I'm ready for him to come out. But at the same time, like, I still kind of want an October baby, but if that means being induced, then no, I don't want an October baby. So I have started and will continue to do different things to hopefully help induce labor. I would much rather have a natural birth than to have labor induced. So, you know, if he comes in October, then so be it. If he comes naturally in October, then so be it. But I would honestly prefer to have a natural birth. So I'm not going to push it, and I'm going to start doing things to help induce labor. And there was something else that I wanted to talk about before I talked about this last thing. But I can't think of what it was right now. And if anybody else has dogs or whatever, or some kind of animal, can you let me know, like, what you did with them to prepare them for a baby being around? I really feel like she'll be fine with around a baby. She's been around them before. My only concern is that if he's laying on the floor or laying in a chair or something like that, my concern is if when she gets too excited, she pretty much just loses her mind. She might as well be brainless. And so I'm worried about her jumping on top of him by accident, but still. So what have you guys done to prepare your animals for a baby and all of that good stuff? Okay, so last thing I'm going to talk about is vagina pain, which is really not even vagina pain. I just don't know what to call it. It's not pelvic pain either. It's one of the things that's making it harder for me to sleep. It's really hard for me to turn from one side to the other because of this pain. And this pain that I have is actually also my fault. Someone had a box mailed here by accident, so they came to get it, and on that day I just had on a shirt. I didn't have any pants, so I got up and was running trying to put on some pants. And after that, I've had this pain down here, and it makes it harder to walk. It hurts to walk sometimes, and then when I'm laying down, it hurts for me to turn or for me to have my legs a certain way. So I you know, have to put my legs a certain way to get comfortable. And I will show you guys where that pain is, and then I will do a belly shot, and that will be the end of this video. And hopefully my next video should be the hospital bag, my bag, and his bag. So I'll see you then. Okie dokie. So let me scoot back. The pain that I have been having is like right here. So it's like right here in the front. It's not underneath or anything like that. It's just here. And it hurts to move my legs or to walk a certain way sometimes. So here's my belly. Underneath clothing. Big old round thing. And here's the other side. And then I guess I could have just left this up and just showed you guys this, but yeah, here's my belly from the front, and then the side you still see that I have these stretch marks here. And actually, I don't know if you guys can see this, but there's like shiny stuff on the front of my belly, and those are actually stretch marks. But I'm thinking that these will actually end up going away a lot faster than the ones on my side because those are darker. So I'm hoping that these right here don't get any darker. And then here is the other side. And the stretch marks on this side actually go all the way around back to my butt. So yeah. And that is it. So I will see you guys in the next video. Deuces.